Welcome everybody to Ecophysiotherapy Presents Health, Wellness, and Lifestyle. My name is Madeline Golick and I'm the owner of Ecophysiotherapy as well as the pelvic floor physiotherapist. And today my guest is Dr. Dominique, so welcome to the show.
Thank you.
So I thought the best place for us to really start is tell us a little bit about you.
Yes. So I'm a naturopathic doctor in Ontario, which means that I'm a primary care provider, and what that means is I am medically trained, but I'm naturally focused. So all my tools are natural. Could be anything from diet therapy, nutritional counseling, which makes actually the foundation of most of my treatment plans with patients, to acupuncture, to supplementation like vitamins, certain extracts from herbs, for example, even to physical modalities. We're also trained in naturopathic manipulation. So everything we do is naturally based, and then as primary care providers, I'm also able to requisition certain lab work as well.
Awesome. Yeah. So that certainly can be helpful because essentially you're a doctor. It's just that you tend to want to help people more from a lifestyle perspective.
Absolutely.
And optimize their health and try to get to the root causes of whatever discomfort
Exactly.
they might be having.
Exactly. So I like to say, the body's connected, right? We know that. And, is symptom A potentially causing symptom B, which is associated with symptom C, and can we figure out what's actually causing all of this, and can we get to the root cause of the issue, and then maybe we'll see some of the other symptoms resolve as well.
Yeah. So I thought for our discussion today, since this is something both of us treat, which is, around digestion, well, I treat more from the perspective of bowel dysfunction, but I thought we could talk about it more generalized. So I wanted to ask, how does somebody know if they have healthy digestion? Like, what are some words or characteristics that might be associated with healthy digestion?
Yeah. So one of the first things I suggest is that somebody actually looks in the toilet after they've had a poop, right? And it's about being really familiar with knowing what your poop looks like, right? And what things you should be looking out for, which would suggest that something else is going on in your digestive system. So what a healthy digestive system looks like is when you have to go to the bathroom, you're able to go, in a few minutes, right?
Yes.
You're not straining.
Absolutely.
Yeah. There's no obvious frank signs of blood in the stool, right?
Yes.
And that can manifest as bright red blood, or it can be actually dark tarry stools, and that is associated with where potentially a bleed would be in the gastrointestinal system.
Okay.
So it's looking about the color. It's looking about, is there undigested food in the toilet?
Makes sense. Yeah.
Yeah. And it's looking about, what's the formation of the stool? Is it solid, which is what is normal and healthy, right?
Yeah.
And it being formed. But if it's not, is it loose? Is it falling apart when you flush the toilet?
Yeah.
Or is it on the other end of the spectrum where it's hard and it's like pellets, right?
Yep.
So really just being familiar with your usage essentially of the bathroom is a really good indicator of how healthy your digestive tract is. And there are other things as well. I mean, if you have chronic bloating or gas, that is also suggestive of something going on in your digestive system, right?
Yes.
And it's also if you are burping a lot, or if you have reflux.
I was just going to ask, is reflux one of the signs?
Absolutely, absolutely. And that's usually something that's going on a little bit higher up around the stomach region.
Mm-hmm.
And so not having really any of those symptoms is usually suggestive of somebody with a very healthy digestive tract.
Absolutely. What could be so you've already alluded to some signs and symptoms that digestion may be off, like obviously if changes in stool, blood in stool,
Yes.
acid reflux, but are there other things that might manifest that might be suggestive of digestion issues?
Well, it's really important to, one, look at digestion, right? Is that where the problem is?
Right.
But we know in our abdominal cavity, we have other organs there, right?
Yes.
And sometimes other issues can manifest as digestive problems, like, for example, endometriosis, which is a common condition that a lot of females have, which is where there is uterine tissue, which is your uterus tissue that is formed actually outside of the uterus.
Yes.
Okay, and so that causes very painful periods, but that is highly associated with irritable bowel syndrome symptoms.
Right.
And so it's really important to be open-minded, right, and see what are all the potential causes going on. We also know somebody with a thyroid issue, particularly hypothyroidism, which is a slowed thyroid, is associated with constipation.
Ah,
right?
okay.
So it's really important to look at the whole system and the whole person, and if something else is potentially causing a digestive issue.
Yeah. What about things like skin? Like, could a digestive issue like acne or other things, like, could that? I assume everything is related, right?
Yeah, it usually is.
Yeah.
Absolutely. So we know skin conditions, for example, rosacea is often associated with something going on in the gut. Yeah, and things like eczema and psoriasis as well, or there tends to be a strong food component association there. And as well, people experiencing headaches, like some people with food sensitivities, for example, can also experience frequent headaches. So those are just a few examples of, other things happening that could be mostly caused by, or at least related to, digestive issues.
Absolutely. And of course, I mean, when you don't have good digestion, then your immune system can suffer, right? I mean, that's where we're getting our nutrients, that's where we're getting our energy.
Yeah.
And so this kind of then sort of, it's the questions coming up is, I hear that the gut is now being sort of referred to as our second brain.
Yes.
So what are your thoughts on that?
That's interesting. Yeah, I would agree with that. We know that we have the gut-brain connection is so integral, right? And when our food moves through our digestive tract, it's an automatic process, right? And we're not consciously doing that. Our body does it on its own.
Yes.
It's involuntary. And so we know that there's a whole bunch of, like, a neuronal network. The nerve connection to the gut is super important. And we know also that about 70% of our immune system is also located in our gut. And what's interesting is that we've studied individuals who have traumatic brain injury, right? And there was a strong association after, let's just say, a concussion of a digestive issue happening. And that's because, for whatever reason, the vagus nerve, which is the nerve from our brain that mostly innervates our abdominal organs, including our intestines, there's some sort of impairment there.
Interesting.
Yeah.
Okay. Yeah. I'm just having like little light bulb moments with some of my own clients who've had concussion and have presented with some digestive issues, and so now it's like, I see the connection. But certainly, I was, hearing on, I don't know if it was Brain Games or some sort of educational video about, the microbiome being really important, and that the microbiome can also affect our mood.
Absolutely. So most of our serotonin is actually also produced in our gut. Yes. And we have, we actually have more microorganisms in our digestive tract than we do cells in our body. So it really is its own little ecosystem there, both with organisms and also the connection, right, with the nerves to our brain. So yeah, I would say that, I think it is a second brain.
Yeah, totally. And even so it's a vice versa. I don't know, it's hard to say. It's kind of like a chicken or the egg discussion, because sometimes our mood or what's happening, in our thoughts and stress and all that can also affect our digestion through the sympathetic nervous system, like our automatic nervous system, right? If we're stressed, I'll often find my patients in high stress situations will complain of digestive issues.
Definitely. Yeah, often stress can definitely manifest in needing to rush to the bathroom or in reflux or, certain symptoms like
urinary frequency.
Urinary frequency too is an interesting one. Yeah. That tends to happen.
I do see that connection there. So I wanted to ask you about, talking about rushing to the bathroom. So let's talk a little bit about IBS.
Yes.
How, from a naturopathic perspective, how do you look at IBS and what things are you sort of looking to see that might be connected, and how do you address that?
IBS is interesting because it still is very much a diagnosis of exclusion, meaning that you need to really look at everything else that could possibly be causing those digestive symptoms and signs potentially, and rule that out. Right. And so, with IBS, you have to look at IBS. I call it heterogeneous, in that somebody can have diarrhea, somebody can have mixed, somebody can have constipation, and we know that the people that truly have IBS, none of them are really the same. And your bathroom usage changes from one day to the next usually as well. And so there are a lot of things that can help people with IBS. We know that diet plays an integral role in either exacerbating or reducing symptoms.
Absolutely.
We know that gluten and dairy, through the research, for whatever reason, tend to exacerbate people with irritable bowel syndrome. So oftentimes, doing a trial and removing those may actually alleviate some of the symptoms, whether that's gas, the bloating, the abdominal pain, or even helping reduce the diarrhea or helping reduce the constipation.
Right.
Some other things too is acupuncture, because there usually is a stress component as well.
I was going to say, because in the physiotherapy realm, with IBS, they're looking at the central nervous system.
Yes.
And, if somebody is under a constant... Now, stress is one of those, really general, vague terms that we, throw out. Our nervous system doesn't really distinguish between there's a lion chasing to kill me and, oh my God, I got to get to this meeting, or I have this deadline, or how am I going to coordinate all the kids? The nervous system responds the same way to those stressors. It becomes a matter of survival. Mm-hmm. So from our understanding is when your body's in that state and it's releasing cortisol and the stress hormones, digestion becomes less important, right? Because it's now a matter of survival. Even though our modern day, we're not necessarily worrying about are we going to die, but the body responds similarly to stressful situations. Digestion isn't important.
I know. I like to say, if you're going through a stressful situation, let's say you're having a really stressful day at work, your body is sending the blood to your limbs, right? Because you're either going to fight or flight, and it's not sending really the blood to your digestive organs, and you really are not in a rest and digest state. Yeah. And so that can actually, have impacts. Gas, bloating, having to run to the bathroom, for example. Yeah. And so working, on lifestyle and stress reduction, whether it being through mindfulness techniques, mindfulness tools, and, just reducing, figuring out ways to reduce stress in somebody's life can usually also have important benefits there as well. Yeah. And with food, we know with IBS, there's certain foods called Fodmaps, which are stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And what those are, they're just certain kinds of carbohydrates. And we know people with IBS tend to be sensitive to certain carbohydrates. Right. And so, and it's been actually studied more frequently, especially in the last 5 to 10 years, is that reducing those foods that are high in Fodmaps can help reduce certain symptoms like gas, bloating, abdominal pain. Right. And then probiotics are also an interesting one too. They've been studied extensively in people with IBS, and some people respond really well to probiotics, but like I mentioned before, because the pool of people with IBS are so different, some people don't respond either. And it's also important, a certain kind of probiotic can be important too. Some we know are really good for IBS diarrhea, and some we know are really better for the constipation. Right. I wanted to just ask a really tidbit question in between going to the next topic, because I know this is kind of a myth, and I want to do a little bit of myth busting. Yes. Does seeing a naturopath mean that, because I have patients, I would see a naturopath, but they're going to tell me to go gluten-free. So it's always they're going to tell me to go gluten-free, and I just can't live that way. Is that really? No, that's absolutely not true. Right. Okay. Yeah. That's why I wanted to, I knew that, but I wanted to hear it, There are definitely some circumstances, and in some conditions we know that gluten-free diets tend to have better results. Yes. But that's based on evidence, right? So as a naturopathic doctor, I am looking at research articles and staying up to date as well. And there's other conditions that, going gluten-free really doesn't really make a difference. So it depends on the individual, and that's why we do individualized medicine. Absolutely. I wanted to toss that in there really, really quickly. So really it's I think with IBS, I think it has to be a holistic, we need to look at the whole person and not just okay, you're having a digestive issue, but what else from whether the environment, whether it's an external, what's going on in the environment, but also what's going on in the environment inside. Exactly. We need to look at it from a holistic perspective, and I think our thoughts and emotions also play a really important, integral part to take a look at. Yeah, they really do. So let's talk a little bit about constipation, because,
one of the things that we talk about in physio is like, okay, increase your water, increase your fiber. But what I wanted to find out is, because there are probably people out there taking like Metamucil and taking their fiber, and they're really drinking water. They may be doing a couple of other things that are good for constipation, but it's not getting better.
Yes.
Why might that be?
So I like to start off by asking somebody who's experiencing chronic constipation is, what does your stool look like, right? Is it hard? And are the pellets, and how are you defining your constipation? Because some people define constipation as, I go 2 to 3 times a week.
Yes.
And other people, it's, I'm actually spending 45 minutes to an hour on the toilet, right? Which, so I'm constipated in that sense, but when I'm able to have a bowel movement, it's completely loose. So it's actually more diarrhea, but I'm spending so much time on the toilet.
Right.
And that really does separate the people that are like the patient essentially into a few different camps. If it's really, really hard stool and hard to pass, and there's a lot of straining, absolutely water, potentially increasing fiber, and Metamucil may help.
Yes.
But if it's really a constipation where the stool actually ends up being loose, then that may be suggestive of a carbohydrate intolerance, and that may be more the IBS or small intestinal bacterial overgrowth camp, right?
Oh, okay.
And sometimes, or actually often, fiber may make those people worse.
Right. So if somebody's increasing their fiber, increasing their water, and they're still having issues on the toilet, they might have more overgrowth.
Potentially, yeah.
Potentially.
Exactly.
Okay.
And testing is also really important with that, right? So if we are suspecting, a small intestinal bacterial overgrowth, which is, as we know through more recent research, a potential cause of IBS, right? It gets a little complicated.
Yeah, it does.
Yeah. Testing is important. So we have breath tests, right? So the patient will breathe out into a tube over the course of 3 hours, and the lab will be able to measure if there is certain gas that's overgrowing, hydrogen or methane, and that would kind of correlate to what bacteria potentially is there, which would potentially, correlate to what symptoms.
Yes.
There's another test of maybe there is a food sensitivity going on or a food intolerance. So we have a food sensitivity testing as well, and that does provide some valuable information. And then it's always really important to rule out red flags as well.
Absolutely.
Yeah.
So let's talk a little bit about Crohn's, colitis, because those are digestive issues.
Yes.
More inflammatory type of conditions.
Yes.
So from a naturopathic perspective, like what are things you're looking at there? Like how can you help that population?
Yes. So with Crohn's and colitis, which is inflammatory bowel disorder, that is by definition where your body, it's an autoimmune disorder, so your body is actually attacking your own tissues. That's just the definition of it. And that is the intestine. Certain areas of the intestine essentially get attacked. And so we see structural differences.
Yes.
And that's what separates IBD, Crohn's and colitis, from IBS.
Okay.
And so really it's about going after the inflammation and reducing the body's mistake. Really what it is a mistake because it's attacking your own tissue.
Yeah.
Reducing that and trying to put the condition, at least reducing the symptoms, or even putting it hopefully into remission. And so certain things there are, diet. So we know the autoimmune paleo protocol, which is a specific diet generally for autoimmune conditions, has been somewhat successful with certain people with IBD.
Yes.
But it's also about the stress component as well, which just weaves its way through so many different health conditions. And also certain herbs and nutrients. So we know things like boswellia can help, and then certain things like curcumin as well, which is a potent anti-inflammatory.
Yes.
And gelatin. So gelatin it's an amino acid which builds certain proteins, but we know that gelatin is really soothing to the digestive tract.
Yeah.
So obviously people with IBD, they're all different, but there are certain things that we know can help.
And I would assume that before people go out there and buy supplements on your own, like, we need to make sure they're the right ones. Absolutely. So you want to seek, professional. Like if you're having a digestive issue, you really need to, seek out somebody professional to try to figure out, which part of the digestion are you having a problem with?
Yes.
Which part of constipation are you having a problem with, right? Versus just sort of trying to Like, it's probably better than trying to do it on your own.
It really is. And we know even people with celiac disease, which is, I think the general population knows a bit more about it now with this whole gluten-free trend than had mentioned 5 or 10 years ago. We know that a lot of people with celiac disease get misdiagnosed with IBS to begin with, right? And so it's really important to see a healthcare practitioner that can properly differentiate, right?
Yes.
What exactly is going on, and then treat what's going on as well.
Yeah.
If you have celiac and all you're doing is trying to address the IBS and still have gluten in your diet, your autoimmune disease is going to continue as it is.
Right. So yeah, very important to get the proper diagnosis,
Yes.
the proper diagnostic testing and proper diagnosis, because that informs our treatment, right?
Exactly.
So I thought maybe we could now talk a little bit about, like, just generally speaking, what are some ways what are some things people could be doing to optimize their digestion?
Yeah, there are a lot of really great, easy ways. One is when you eat food, eat sitting down, right? So, I know, especially with fast-paced society, people are working crazy hours, it's really easy to grab something and then just walk while eating, and you're on your phone or whatever. Or, eating at your desk while doing work puts you generally in a higher stress type of mindset, right? So eating at a table, not doing any work, can help put you in a rest and digest state. That's number one. Yeah.
That makes so much sense. Because, even in my practice, we'll talk, we'll see evidence supporting things like mindful eating.
Yes.
Where you sit down and I recall that, talking with somebody, and they were like, you really should sit down and just, like, chew your food.
Yes.
Right? Like, really just spend some time, chew your food, actually taste your food and relax. But it makes total sense because, like, if I'm trying to catch up on my patient notes and I'm just heaving food in because my next client's coming in 10 minutes, like I feel like that's probably not helping my digestion, and I've noticed a difference. Like, I notice a difference
Likewise.
where I've inhaled food versus sitting down. And it actually happened to me yesterday. I inhaled soup because my client was late. I was like, oh, I'll just eat, and then they showed up, and I'm like, I haven't eaten. And then all I had was gurgling all day, and I just kept saying to my patients, that's my tummy, that's my tummy. But it makes a difference.
It really does. Yeah.
Okay, great tip.
It really does. Well, and the second one was chew your food, right? Because your digestion is not just here, it starts in your mouth. Like, we have enzymes, salivary enzymes that start to break down your food as soon as you eat your food. So it's, your body is doing a job somewhere right along the digestive tract. So chewing is important. Water intake is important too. Right.
Yep.
And there's no really, specific goal. Have 8 glasses a day. That's actually based on a myth.
Okay.
And was never really proven in research. But drink enough water so that you feel hydrated.
Yeah.
Right. And particularly is also when we have hotter days like today. Third is there are certain things you can do that are really easy, like to stimulate your digestive juices. Some people, you can take a small little shot of apple cider vinegar in a cup of water right before you eat, and that will start stimulating the release of digestive juices, which can potentially help you digest your food better. And
exercise.
And exercise was the next one. Yeah.
Just walking, go for a little walk. Just and you can even do short little bursts of increasing just to get that heart pumping. But that's really one of the key things that I talk with all of my clients when they're with constipation, right? Just getting up and moving the body.
Yeah.
Right.
Yeah. Exactly.
Preferably without being on your phone, right? So I think the answer is really taking and dedicating that self-care time.
Yes, absolutely.
No.
And speaking of self-care is, if you feel rushed in the morning, often the morning is one of the most stressful parts of the day. Be mindful and allocate more time to the bathroom if that's what you need, right? So if that's waking up 10 minutes or 15 minutes earlier, then so be it, if that's going to allow you to be a little bit less stressed and allow you to be more successful in the bathroom.
Yes.
If stress is a major component of you having digestive issues.
Yeah.
Yeah.
Those are really, really great tips. I want to thank you so much for taking the time to chat with me a little bit about, about these lovely topics, but they're so important, right? Like we need food to live, right? So why not try to optimize digestion as much as possible? And if you're having digestive issues, that's why we have medical professionals who can help with those issues so that you can basically live a better quality of life. So thank you so much for sharing your knowledge.
My pleasure.
Awesome. So thanks guys for watching, and we'll see you next time.